Kaizen in car manufacturing, or Six Sigma, or lean manufacturing, and so forth. There's been a lot of innovation in system organization that for some reason hasn't reached the healthcare system. Think about, you know, the car industry and what it meant 30 years ago to start a car. You weren't sure that the car would start, actually. You had to, each morning, you had to manage somehow, and maybe, you know, 3 times, wait a bit, 4 times, wait 5 minutes, and so forth. Of course, today you expect your car, you don't even think about it. You don't even think, well, you know, maybe the car won't start. So this has happened not just by technological progress. It has happened because there are new ways that have been developed in the car industry to, you know, put the whole manufacturing process around the car. So for some reason, I hear some similarities, and it's a bit provocative when I hear about, you know, patient centricity. Say, well, are we really there? Is there an integrated dialogue among all the people who have to deal with what is a patient, so that they communicate when there's a problem, they integrate their own services, and so forth. And these are the problems that are affecting our healthcare systems today, and these are the problems that some of those solutions are trying to solve. One of the starting point of this report on innovative healthcare delivery models was to really focus on human capital. And here, again, when we think about inefficiencies or lack of productivity, we think about the working, the paid workforce, the healthcare professionals. While in fact, we know by experience that healthcare is very much happening outside this formal system. There is a lot of organizations and people involved in the informal part of the care. In fact, if you have to deal with chronic disease, you're basically on your own. Most of the care that you receive when you're having a chronic disease is self-care. You have to deal with your disease yourself, and eventually you're developing a really high level of expertise of what works for you, what doesn't work, your compliance and your lifestyle and so forth. And this is why we see a lot of patient movements who are basically saying, look, I know probably as much, if not better, what works for me than the formal healthcare provision system. So we need to really embrace these needs and opportunities to increase what we call the human capital across this whole spectrum. Sorry. So this report was basically came from work that was done through the World Economic Forum and various academic institutions like Duke University in the US. And the starting point was to identify really innovative ways of delivering healthcare across the world. So not only in developed countries, but also in developing countries, and try to see what has worked, why is it just at the local level? Can it be deployed at the regional level? Is there something to learn? And in the report that I'm basically reporting about here today, we teased out 9 case studies, and 9 case studies that could perfectly illustrate some of the lessons that can be learned from these innovative models. And here, I don't have enough time to go through those examples, but I invite you to look at the report, which is a really good read. But just taking, 4 examples so you get an idea of what we're talking about. Things has, radical or science fiction sounding, such as an automated machine to deliver prescription products on 24 hours, 7 days a week. There's a very good reason why this has been developed, and it's been deployed in 34 states in the US, because you have large rural areas, empty spaces, where eventually it's pretty hard to get access to your local pharmacy. So why not just put an automating machine based on e-prescription, which is going to deliver your prescribed medicine when you need it, and when you're able to go get it. And if you have a question, there's a video link to a pharmacist, So these technologies are out there, Skype, email, so forth. There's a good reason in healthcare that we could embrace some of those technologies. It's not a cost issue here. Something in the UK, the Marie Curie Cancer Care, they developed this initiative called Delivering Choice. And Delivering Choice is basically looking at end-of-life care. And they realized that the patients in end-of-life care would receive visits from healthcare professionals for different reasons, several times a day, several times a week. And that was extremely disruptive for those patients. And so they decided to centralize, to create a new job, a care and social coordinator who doesn't need to be a doctor, who doesn't need to receive a long training. Actually, it's based on a 3-week training and monitoring. And this person is going to be the key interlocutor for the patient and the healthcare service. And again, as a patient, or as the parent of a patient, you can realize the need for this type of new system or new delivery method, because otherwise you have to run a micro enterprise when you're dealing with an old patient with multiple morbidities. Basically, you have to face the healthcare system on your own. So there's really great opportunities for the healthcare system to organize it so that better care can be achieved at a lower cost and less hospitalization. And all those examples here have shown that they achieve those results. It costs less money and it provides better care. In Sweden, they are at the cutting edge in terms of access to patient records. And as we said, in Denmark, sorry, got confused with another thing. So in Denmark, they have the same in Sweden, so that's why I got confused. So, and in China, I mean, this is one example, but the European Commission, DG Information, just released a book. It's a very heavy book, glossy paper, and it's hundreds and hundreds of applications for smartphones related to health. And here, this is one that was developed by Microsoft for Chinese diabetic patient, and it's basically designed as a game. And this is also an important trend that healthcare people need to take into account, is the gamification of policy. Basically, you're using games to engage people in doing something you want them to do. So it's not just nudging people, but it's involving them in games. And if I have more time later, I can give you some good examples of those games. So this report came out with 5 key principles. And here, it's a mix of common sense, of system change management, like Six Sigma and all that, standardize the process. Once you standardize the process, then you can understand what type of skill you need where. And that's this idea of right skilling your workforce. More often than not, we see highly trained professionals managing the stock, the inventory of supplies. They're or doing administrative work. It's not the right or appropriate use of this resource. So those examples are basically redesigning the system so that you have the right use of your professionals at the right level. So I'm not going to go through the 5 key principles because I'm coming at the end of my talking time. But in the report, you can find a list of proposals and recommendations. The stars here are just indications from the people who wrote the report about quick wins, first steps that can be implemented. And again, in terms of technology, embracing technology, if you look at the quick win on aligning financial rules and incentives, which is the second box, one of the quick wins is pay for email, phone, web, group encounters. So that means that today the payment system for healthcare professionals is designed so that they have to meet the patient. So if policymakers don't change that, they're not going to see a lot of improvement in terms of innovative ways to interacting with the patient, because the healthcare professionals will not be compensated for that for doing that. It's very simple, but it's also very understandable. So this is the working group members, a wide array of different sectors, academia, ministers of health, different countries, developed. And this is where you can find the report, A Neglected Resource, Transforming Healthcare Through Human Capital. And I put here the link to this innovative international partnership for innovative healthcare delivery, because they have additional examples. A lot of those examples can be replicated fairly easily. They are piloted and they are expanded. So I would invite you to take note of this report. Thank you.
Stipe, thank you for not announcing us, because we will save some time. And I think it is fair to speak in English, because our dear colleagues here arrived to Venice at 11 o'clock, so I think it would be much easier to follow in English. I never presented this before, so I am not using old slides. I'm using new slides to respect this audience, because I spend in basic clinical and industrial science my career. So I was asked to give some perspective of why I believe that pharmaceutical innovation has some problems at this current time. So this slide I drew last night because I wanted to put some emphasis on how we're going to achieve 2 years of longevity and lifespan of humans as the next European target. And I would like to emphasize that I deeply believe that these are the 3 factors involved in lifespan. We heard from Frank in the first slide that pharmaceutical industry and new drugs played a very significant role. And he had also the clean water, or the drinking water, and water in any type of use, extended our life for 20 years, and then vaccination, which is all the time heavily criticized, expanded our life for 20 years, and then new drugs for 10 years. I don't know what is next and what is the basis of the crisis, so let's see whether we have some other elements we can attribute the crisis currently. These are our friends in a campaign, Obama and Romney, and they were asked by Scientific American to give their reflection on 14 top scientific questions, and they are listed in a right hand. And I have just outlined some of them. It's innovation and economy, research and the future, and at the end, vaccination and public health. And they both support SAT, and it would be strange if they didn't, because half of the US economy growth since World War II is based on science. I wouldn't show Croatian figures, I have them, but we can discuss them a little later. When I was asking Minister Linić what he says about Croatian science, he said, "What? Science? Don't mention that anymore in Croatia." So US economy is 50% based on science. They both said they want to doubling the funding, which is very nice, and I believe they will definitely succeed. And they want to invest more than 3% in GDP. And what is very important, at least to me, that they enforce vaccination in the interest of public health. Remember the Triple Lancet case in 1998, when they also said that autism comes out from vaccinating the kids against parotitis and some other diseases, and that was a horror, but people were in jail at the end. In Croatia, they are not in jail. They are in the first Croatian public television. Okay, so what is the difference between academia and pharmaceutical science? In academia, I spend a lot of time, I'm still in academia and pharmaceutical science, and I don't believe in stem cells. The Nobel Prize has been given to stem cells, but I don't believe that embryonic stem cell will ever make money. So we will see a lot of beautiful scientific papers on the cover of Science, Nature, and Cell, but there will be no products. As you can see, it was a lot of Geron Corporation in Atlanta. They moved away from the first indication from embryonic stem cells. I don't believe in cells, but I believe in what the cells are producing and how the cells are acting. If we understand the mechanism, we will find small molecules, we will find pharmaceuticals which will replace the cells. So if you come back to Ezekiel, I put Ezekiel here down. He was a prophet from Old Testament, and I'm not using Einstein because it's very easy to use Einstein, but I will go back to Ezekiel. He said, "I will remove from you your heart of stone and give you a heart of flesh." That's the regenerative medicine of today. And let me show you a couple of examples and how the pharmaceutical industry will continue from this point.